everyone. My name is Curtin Baldwin. I'm the Public Information Officer for Memorial Healthcare System. We want to welcome you this afternoon to this historical event. We also want to send a warm welcome to our community who is watching us through Facebook and other social media venues. This is actually a very historical event for us, in which Memorial Healthcare System will launch its vaccine program for its frontline staff today. We're here with members of our executive team, our leaders, our healthcare team, to share information about this historical event, what it means for us, how we have organized everything that we've done behind the scenes to get to this day, and of course talk a little bit about our vaccine operations and the vaccine. So I'm going to start, and let me introduce you with Aurelio Fernandez. He's the Memorial Healthcare System President and CEO. Thank you.
Thank you, Curtin, and welcome. As Curtin indicated, this is a historic event. We've been in this journey now for 10 months. Our first patient came to us on March the 7th, and we've been working very hard. The 14,000 employees of the Memorial Healthcare System really were in the front lines, and that's what you hear everywhere. We call them the heroes, because they were true heroes. And now, for the first time, we're seeing light at the end of the tunnel. This is going to be a long journey. It's not over by no means, but nevertheless, it is the beginning of something that's going to be very, very positive. We're very fortunate to be one of 5 healthcare systems that were identified by the governor's office to be the recipients of the vaccine, and they were received this morning. We're also in contact with neighboring hospitals in Broward County. We have identified 5 other healthcare hospitals that will participate in this endeavor. So it is for the current allotment of vaccines is for the employees, the frontline employees that work in critical care areas, in the emergency department, for over our 2,000 physicians that make up the Memorial family. We first got to take care of those individuals who are taking care of all of you. So we appreciate your patience. We will have vaccines for everyone. I know that both CVS and Walgreens will be administering the vaccine in nursing home and long-term facilities. This is only right now for employees of the healthcare system, and I'm sure with the other manufacturers as they come out, they will also be delivering. So with that, I'm going to turn it over to our Chief Medical Officer, Dr. Tom Macaluso. Tom?
Thank you, Aurelio. So as Aurelio said, we received vaccine this morning. We received 19,500 doses of the Pfizer vaccine. That's going to be administered, as said, to our frontline healthcare workers. So that's medical staff, nursing staff, and any clinician or worker who's at risk for either contracting COVID-19 from a patient or from spreading it to a patient. So that's that first target. And I want to emphasize to our employees and medical staff that this vaccine has been shown to be 94% effective. I think most of you have seen that. This target audience, pretty much everybody except somebody who's had a severe allergic reaction to a vaccine is eligible to get this vaccine. It's been studied in over 30,000 people in the phase 3 trials. It showed it is safe. There are expected side effects similar to other vaccines, but I just want to encourage our employees, our medical staff, to take advantage of this great opportunity. This vaccine and the other vaccines that come down the pipeline are really going to be the key tool to ending this pandemic, and we're all looking forward to that. So thank you, and I'm going to turn it over to our Chief Nurse Executive, Maggie Hansen.
Thank you. Today there is a ray of hope that is new for us, for our clinical frontline caregivers who have been battling this COVID-19 pandemic for 9 months already. It has been very taxing for them professionally and personally for 9 months. Professionally, they've never seen morbidity and mortality like this. They're tired. Some of them are working 4th and 5th shifts, 12-hour shifts in the week, and they're ready for this to be over. Personally, they're dealing with everything else that we are dealing with out there. The problem is that they're stressed at work, they're going home, and there's no time to rally before they go back to do it all over again. And yet they do, because they're strong and they're resilient. But today, we now have an opportunity to offer them what they need to stay well so that they can carry us through to the end of this pandemic. The vaccine has been prioritized for them, appropriately so, because they have to stay healthy and strong to care for us as well as the population that we serve. It's very important that we let them get vaccinated to stay healthy and strong. It's tangible now, okay? The vaccine has finally arrived, and with it being tangible, they're able to see the light at the end of the tunnel. They are able to visualize the end of the pandemic when they can return to providing care like they did before, armed actually with a few new lessons that they've learned during the COVID-19 pandemic related to infection control and prevention. It's time. We have worked on this for a long time. We have watched the vaccine preparation for months already. We have developed a process that will be easy for our employees to use, our physicians to use, to be able to get scheduled for their vaccine. We have for our physicians a telephonic process for them to be able to schedule their vaccines. For our employees, they will be able to leverage the MyChart application in the electronic medical record, where they can sign in, they can read about the COVID-19 vaccine, get educated, they can fill out the pre-screening questionnaire, and then consent for the vaccine and actually get scheduled, all in one fell swoop. Very easy. We anticipate then that once they've made their appointment, they will arrive at their scheduled time to our vaccination center here, which you're going to have the opportunity to see. They will be screened again to make sure nothing has changed from the time that they filled out their screening questionnaire. They'll be accompanied to a registration station for proper identification. They'll be moved to a private area where they will receive the vaccination, and then observed in an area where we have them socially, physically distanced for 15 to 20 minutes before we send them on their way. Once they're on their way, shortly thereafter, they will receive a reminder to sign up for their second vaccine. This is a two-part vaccine. About 21 days post receiving their first vaccine, they will need to be back for their second vaccine to take advantage of the effectiveness, which is very effective, 95% effective. So it's a wonderful process. We know that our employees will enjoy moving through this and being able to protect themselves so that they can carry us through to the end of this pandemic. The vaccine is the most powerful tool that we have, the biggest weapon in fighting the COVID vaccine. It is my privilege now to introduce Dorinda Segovia, Dr. Dorinda Segovia, who is our Vice President of Pharmacy Services for the Memorial Healthcare System. Thank you.
Good afternoon, everybody. Today is a wonderful day in the history of mankind. Like Dr. Macaluso said, we received over 1,900 doses of the vaccine to help be part of the solution in this healthcare crisis that we're trying to fight as a community. We have, over the last few months, we've been getting ready for today. And we successfully received all the vaccine that was shipped to us. We have prepared for receipt, storage, preparation, and distribution. The team of pharmacists has worked diligently with the medical staff in developing protocols to determine patient eligibility, criteria, and to make sure that we are able to vaccinate. Our goal will be 120 patients per hour. The team here has diligently worked on the logistics, from procuring refrigerators, freezers, ultra-cold freezers. Every timing from the point that the vaccine arrived to the timing of putting it in the freezer, to the transfer to the refrigerator, to the transfer to our vaccination floor, to the preparation of every single syringe in a sterile process so that we can provide our nurses and our patients the vaccinations that they need. Our team is composed of medication safety, informatics. We have pharmacists that work in the informatics department that this morning we're here ready to make sure that we are safely barcoding that medication with all the information that needs to be part of the medical record. I'm very proud to be part of this moment. I'm very proud to be working with Memorial and extremely honored to have received the shipment of the vaccine to start making a difference with our patients.
Thank you, everyone. Now what we're going to do, I'm going to bring forward also Dorinda again, and also Dr. Paula Eckert, who is our Chief of Infectious Disease, who will now say a few sound bites in Spanish for our Spanish media. Thank you.
Buenas tardes. Yo voy a dar algunas palabras en español. El sistema de salud de Memorial ha sido uno de los escogidos de los 5 sistemas hospitalarios en el sur de en la Florida para recibir y distribuir la vacuna y administrar la vacuna a todas las personas que califican para ella. Como ya se ha dicho aquí, hemos recibido más de 19,000 dosis de la vacuna y esperamos empezar a vacunar a la gente desde el día de mañana. Sabemos que la vacuna es efectiva, es segura y tenemos un sistema en esta farmacia atrás de nosotros donde el empleado de salud puede hacer una cita a través de la computadora o de su app en el teléfono o llamar a un número telefónico para hacer la cita para ponerse la vacuna. Cuando lleguen a ponerse la vacuna hay varias preguntas que se van a contestar. Si las únicas personas que no calificarían para la vacuna serían aquellas personas que han tenido una reacción exagerada a otra vacuna, pero si no tienen nada de eso, las personas se pueden vacunar sin ningún problema. Se van a observar aquí después de la vacunación y después cuando se vayan yendo para sus casas van a recibir un recordatorio para la vacunación que sigue, porque esta vacunación es 2 administraciones, una el primer día y una a los 21 días de la primera vacuna. Entonces es para nosotros de verdad un honor poder ayudar a que esta pandemia culmine y yo creo que la vacuna es uno de los elementos muy importantes que tenemos que tener en cuenta para poder concluir con esto que estamos pasando. Muchas gracias.
Muy buenas tardes, tengan todos. Mi nombre es Dorinda Segovia y soy la vicepresidenta de farmacia de Memorial Healthcare System. Hoy ha sido un día extraordinario para nosotros. Nos hemos llevado preparando como unos 9 meses preparándonos para la llegada del día de hoy. Hemos recibido más de 19,000 vacunas para poder, 19,000 dosis de vacunas para poder vacunar a nuestros empleados que están en las líneas a primera línea enfrentando la enfermedad. El departamento se ha preparado desde comprar refrigeradores, congeladores, neveras de bajo cero para poder guardar la vacuna y estar seguro de que la preservamos lo más posible. También estamos preparados para preparar las dosis para las enfermeras. Cada dosis es individual, de una manera bien estéril para poder proteger la vacuna y también para estarnos seguros de que no la malgastemos. No queremos botar ni una dosis. Como se pueden imaginar, la vacuna es muy valiosa, la hemos estado esperando por muchísimo tiempo y estamos preparados para servir a nuestra comunidad médica. Gracias.
Thank you. At this time, now that we have done Spanish and English sound bites for our local press and our national press and our community out there as well, we are going to open it up for questions and answers. Does anyone have any questions?
Absolutely. We actually have pharmacists on site waiting to be the first ones to be vaccinated.
Okay, logistically, you talked about 120 per hour. How long down the road do you have participation you want before you take your employees and 25 hospitals?
So we have vaccination waves, and I will defer that to our administrators, but we have a vaccination wave for our employees, our first line employees, and we are also ready to help our community hospitals, like stated by our President Aurelio Fernandez.
Last thing, I'm sure the mayor's here. You don't want Miramar residents, any of the residents in our community, to think this is over, the things you've been saying, mask, social distancing. Just give people a warning that we still have to try to do the right thing.
That is correct. The vaccine will take time to create immunity. We also do not know what kind of exposure we have had until the time of the vaccine. So mask on at all times. It doesn't matter if you're vaccinated. That's the way we're going to protect our families and our communities. Absolutely.
Disculpa, en español, cuando hablan de que han estado en comunicación con otros 5 hospitales, son 5 hospitales adicionales al Memorial System que ustedes les distribuirían a ellos. ¿Cómo funcionaría esa parte?
Les voy a dejar que el presidente responda. En español. Sí, son 5 otras cadenas de hospitales, no solamente para Memorial, o sea, otros hospitales de la comunidad que son compañeros con nosotros sobre la salud. Entonces, esos hospitales los vamos a ayudar también a poder repartir la vacuna.
¿Y cuántos de ustedes, doctora? ¿Cuántos van a recibir aquí ustedes en Memorial? ¿Qué cantidad?
Hemos recibido 19.500 dosis.
Pero para los 5 hospitales. ¿Solo para ustedes?
No.
¿Cuántos?
Mira, son 5 hospitales. Cleveland Clinic, Broward General, Westside, Florida Medical Center, and Holy Cross. ¿Ok? Entonces, los 19.500, lo que sobra se van a distribuir en esos 5 hospitales. Pero ya para la semana que viene va a venir otro shipment.
Pero ustedes no saben cuánto es para ustedes.
Sí, 19.500. Pero nosotros tenemos 14.000 empleados. Yeah. We think we're going to use about 7,000. So the residual, or the 13,000, would be distributed to the other 5 hospitals and whoever else we can help. This is a very collaborative approach.
How many people do you plan on vaccinating, and how long do you think that's going to take?
We're projecting about 7,000, which is 50% of the employees. As Dorinda said earlier, we project about 1,100 to 1,200 vaccines every day in this facility.
And when is it going to be? Today, is it starting with the
Tomorrow we start.
tomorrow you start?
Do you have an expected date for the next shipment?
21 days. So the second dose is a new shipment. The next shipment is the 20-something. 23 days.
También, ¿cuál es la receptividad que han tenido por parte de los trabajadores de la salud? En algunos sondeos se habló de que había cierto miedo dentro de los propios trabajadores de los hospitales. ¿Qué percepción tienen ustedes del sistema Memorial?
Nosotros no abrimos el horario para hacer las citas hoy en día, y ya para mañana tenemos bastantes appointments, tenemos bastantes citas. Ya tenemos más de 300 empleados que han hecho su cita para vacunarse. Siempre las personas tienen miedo, por supuesto, todas las medicinas tienen efectos secundarios, incluyendo la aspirina, y todos tomamos aspirina una vez al día. La vacuna tiene efectos secundarios, dolores de cabeza, dolores del cuerpo, puede tener que tenga fiebre, pero no son efectos muy drásticos. La vacuna es 95% efectiva y los efectos secundarios no son diferentes a otras vacunas que ya existen en el mercado.
Can you say that in English, please? The safety and side effects.
Absolutely.
I was going to ask Dr. Eckert to also.
Doctor, do you want to talk about in English on the...
Well, I wanted to finish answering your question, because you were saying that if we needed to continue to use masks and after vaccination, and the actual clinical trials still do not give us any information about transmission after vaccination. So the recommendation by the CDC is that we should continue wearing masks until more information and do, hand hygiene, all the things that we're doing right now, until more information comes about and until more people get vaccinated. So it's definitely important that people understand that just by getting the vaccine, we're not throwing the masks out.
The safety and
Well, like Dr. Macaluso did say at the beginning, the clinical studies show that it's safe. We don't have a long-term follow-up on those patients. Most of the people have, especially at the second dose, they can have body aches, maybe a fever. They could potentially have a fever, but mostly it's like arm pain, redness in the arm, like that happens with other vaccines. But apparently with the second dose, it could be more so. And the younger you are, probably the more you could react to the vaccine. ¿Cómo? No te oigo. El proceso para vacunar a centurión. El proceso para vacunar.
Los pacientes, los empleados tienen un sistema electrónico en la computadora, through MyChart, que es el sistema que usamos nosotros de récords electrónicos. El paciente, el empleado va a MyChart, pone la hora que quieren venir a la cita. También responden todas las preguntas que están en la orden de emergencia, del uso de emergencia. Responden preguntas sobre su información médica, si tienen alguna alergia, si han recibido la vacuna antes, si tienen fiebre, que los puedan descartar. Si no están descartados, en la próxima pantalla los permite hacer una cita a su conveniencia entre las horas de 9 de la mañana a 9 de la noche, que se pueden venir a vacunar. Cuando lleguen, se registran, solamente tienen que dar la fecha de nacimiento y el nombre y volver a pasar otras preguntas, que son las mismas preguntas que respondieron en la computadora, pero para validar. Y entonces reciben su vacuna, que está ya preparada, y esperan media hora para estar seguros de que no tienen efectos secundarios y que se pueden marchar a la casa.
Doctor, I know you're dealing with what's right in front of you today, but Thursday, FDA meets again. We're going to have another one in the pipeline. This logistical operation all set up. You feel that that'll be the same thing? What you've learned here, you can apply to that, and that'll help do this.
Absolutely. The vaccines are not interchangeable. So if you receive the Pfizer vaccine tomorrow, 19 days from now, you have to receive the Pfizer vaccine as well. So from a logistics perspective, we are ready to manage the differences in inventory, as well as the differences with the vaccination requirements. The vaccines are the same, but they're different. And so it's not recommended that we interchange one vaccine for the other. Yes, I can. I think. Sí. Las vacunas no son intercambiables. El paciente que se vacune con la vacuna de Pfizer necesita recibir la vacuna de Pfizer de 19 a 23 días después. El paciente que reciba la vacuna de Moderna necesita la misma vacuna para la segunda dosis. Tenemos una tercera vacuna que está en trials, en estudios, y esa tercera vacuna no necesita una segunda dosis.
The Miami Herald? Go ahead.
I have a question on the 7,000 doses. Is that all high contact workers, or does that include all Memorial physicians? And was that at the discretion of Memorial about how much Memorial would take, or did the state direct you to take 7,000 and they give the rest?
That's an Aurelio question. It is 19,500 doses that we have. And by the way, we probably have a little bit more. Every vaccine comes with an overfill, and we are allowed to use the overfill. And we have calculated that we can actually vaccinate 7 patients per vial because of the overfill in the vial.
My question was about the 7,000 doses that you said Memorial would be taking.
We did not give you a number of doses that Memorial will be taking, but I'll pass that to Aurelio.
We project about 50% of the employees will participate with the vaccinations. And then because we're the host of the vaccines, we need to oversee when we send the doses, the residual doses, to the sister hospitals in the area. We need to oversee that process as well.
Will they 7,000, is that accurate?
No, we go there.
Was 7,000 doses for Memorial employees, is that accurate?
No, it's not an accurate, it's an estimate.
That's an estimate, and you don't know how many are going to actually take?
We have 14,000 employees, so I'm assuming a 50% participation.
But that would be not just high contact employees, right? That would be all
Front lines.
all front line.
Wow. Si nosotros recibimos 19.500 dosis y creo que el 50% de la empleomanía va a utilizar la vacuna. Quiere decir que 7.000. Esos 7.000 que sobran se van a distribuir entre 5 hospitales aquí en el sur de la Florida, que es Broward General, Holy Cross, Cleveland Clinic, Florida Medical Center y Westside. Got it?
We're going to go ahead and take one last question. Does anybody have one last question that hasn't been asked before?
I have a question about the overflow liquid of the vaccine. How does that work? Can you mix and match from bottles of that vaccine? How long do you need to use that overflow vaccine?
So she asked me a question about the overflow. We would not mix vaccines from one bottle to another, but we would extract the amount of vaccine. We have instructions from Pfizer that we can extract the amount of vaccine from a vial for a full vaccination.
All right, excellent.
Thank you.
Thank you everyone so much for attending. We understand this is a very historical event, and we are very grateful that you are here sharing this great news with us and also informing our community.